amigos. This is Cristina Luna. I am, again, one more time with Elizabeth, Vice President of Lehigh Valley Hospital, Poconos. We're going to talk about the concerns that parents have about the vaccine for COVID-19 for their kids, for the younger ones. Hello, Elizabeth. How are you?
Good. Thank you for having me. I really appreciate it.
Thank you so much. We want to address the concerns that parents have because there are many fears. I want to tell you that I was fearful too as a parent. I have a 6-year-old daughter, and my husband was, no, she has to get vaccinated. In my times, we had polio. Kids were disappearing from the class from polio. Once they had the vaccine, nobody questioned it. We were so happy to have it. And I want to tell you, it was a great experience. My daughter is fully vaccinated. The people in Lehigh Valley Hospital Pocono were very nice, beautiful people, very kind, very nurturing. They had candy for them and they were drawing on the walls. I want to thank you. Please thank all the staff that are doing this because it brings great comfort for the kids and for the parents. So now let's start with the concerns. I have gathered the questions that from our community, from parents. I have done some research too. So we're going to address, guys, all those things that you want to know, because this is coming from the source of a professional, from the president of Lehigh Valley Hospital, Pocono. So it's a direct source. So let's start. Elizabeth, there are concerns on how quickly the COVID vaccine was made available to children. Can you tell us a little bit about the vaccine trial that may help ease the concern of parents?
So coronavirus vaccines have been around for nearly 10 years, but the CDC would not approve a vaccine unless it was safe for children. And so what we do are called clinical trials or research, in which thousands of children, different ages, get vaccinated, and they look to monitor them to see if there's any complications before they even determine that they're safe to be released to the general public. So there have been research, clinical trials to make sure that these are safe and effective.
Yeah. Do you know how long these trials and how many kids have been in the trials?
I don't have the exact number or the amount of time, but it's enough science that we could make a decision that they're safe and effective.
Thank you. Now, what kind of short-term effects can we expect once we get our children vaccinated? I have to tell you that my daughter didn't have any side effects. She went to swimming class straight away, and she was perfectly fine. But
so most of the symptoms that we're finding, if you have any, are really related to the area where you gave the vaccine. So there might be some tenderness, some redness, maybe a little bit of swelling. It might feel a little warm to the touch, but that goes away either the next day or the day after, within 24 to 48 hours. Some children may respond to the vaccine. So they may have things like chills, feeling tired, maybe not loss of appetite, but those go away usually the next day or the day after.
Thank you. What about the long-term side effects? There are some, rumors going on about fertility issues or heart issues. Can you tell us a little bit about that?
So there is nothing that has come forward that says these have any effect on fertility, on cardiac disease, there are no long-term effects. So people can be not afraid that something in the future is going to happen because of giving their child the vaccine today.
What about the DNA? Because there are other rumors that say that the vaccine can alter your DNA.
That is a myth. There is no fact to that at all. This vaccine will not alter any DNA in children or adults.
We're sure about that, right?
Absolutely.
Why should children get the vaccine? Through they're less likely to get very sick with COVID.
So there's a couple reasons why you would want to vaccinate your children. First is to protect them, because if they do get sick from COVID, they can have some serious complications. We have seen that in some children. The other reason to get vaccinated is if they do get COVID, or if they get vaccinated, then hopefully they will not get COVID and not pass it on to the adults in their lives who can get really sick as a result of getting COVID.
Yeah.
So it's really, one, to protect them because they can get sick, but two, also to protect the adults that they live with and love.
That's true, because kids are known for passing all kinds of viruses, right?
Yes, they have a lot of germs because they interact with other kids that are, in the classroom.
Yeah, that's true. And will the vaccine, now we have a lot of other variants constantly, right? And
Yes.
how does the vaccine protect against the newer variants that we have?
So that's an interesting question, because as a new variant comes out, the manufacturers of the vaccine will test to see if the vaccine is effective against that variant. And if they need to change how the vaccine is manufactured, they're going to have to do that to react to different variants, because there will be different variants that will emerge. The new Omicron variant, just recently we're finding that it's not as severe as the other variants that have come forward. So there will have to be further testing to make sure the vaccines are effective against new variants.
But are they somehow effective still? The vaccine is against the variants? Is it better to vaccinate?
Absolutely. It is better to be vaccinated, because even if you do get it, COVID, with the new variants, you're less likely to be very seriously sick.
Yeah. I also have heard from parents that say, well, I'm not against vaccinating, but I'm going to wait and see what happens with other kids, wait until they make a better vaccine. What would you tell to parents that have this in mind?
I have two words: don't wait. The time is now for us as a country to come together to get vaccinated. One, we've talked about this before, that if enough of us are vaccinated, we get this immune response that is, works against the vaccine. But that is only if the majority of the population is vaccinated.
Thank you.
It's called herd immunity.
Do we have the herd immunity or not yet?
Not here in Monroe County. And we're getting there as a country, where a majority of people at least have gotten one shot. But if you look at by region, you have to look at individually the region, because we're interacting with each other in the area.
Of course. Now, I have another question of one of the parents that says, does my child still need the vaccine when he or she got COVID? And if so, how long do they have to wait until they get it?
That is another excellent question. So the answer is yes, you should get vaccinated, even if your child has had COVID. So you will get immunity for a period of time. Originally, our thought was for up to a year, but again, there's some things we don't know. But even if you've had COVID, we still recommend that you get vaccinated, and you don't have to wait for that period. You don't have to wait any period of time.
No, not at all. Because some people, even adults, say that they have to wait. They wait for 4 to 6 months.
Yeah, the original thinking, Christina, was at least 3 months, and we've revised our thinking. So because again, the new variants, what's happening in the environment. So
they shouldn't wait at all.
They could, because you still have immunity, but it's not required that you wait.
Okay. It seems, are there a number of cases going down? And if there are, is it still necessary? Because it seems like we had things under control for a while. What can you tell us about that?
Right? Remember, we were in the summertime where people were outdoors. They weren't closed in, gathered together. We had holiday picnics that were outside. We're now moving indoors, right? We just had Thanksgiving where families came together. We have major holidays that are coming up where in your home, you may have vaccinated and unvaccinated family members that come. that could potentially bring COVID. So what we are seeing right now today is cases are going up. And we believe they're going up because we just spent Thanksgiving together and we're indoors more.
So the cases are going up. You mean hospitalizations?
Yes, hospitalizations.
And are these people vaccinated or not vaccinated, these patients?
A majority of the patients are unvaccinated.
Yeah. Okay. Because I hear rumors that people say, oh, I don't want to get the vaccine because I know somebody that got the vaccine and then they were very sick and they were hospitalized.
If you get the vaccine, you are least likely to be hospitalized.
And that's
you still
clear.
Can have some breakthrough cases, but you're not as sick as if you didn't get vaccinated.
Yeah. And the vaccine has been approved for children between the ages 5 to 11 now. Does the child's weight play a factor in that? Because some people think, oh, how can you put the same amount of vaccine to a child that maybe has the weight of an adult or a child that maybe is like underweight?
That's another good question because as a parent, sometimes when you're giving other medicines like Tylenol, it's based on the child's weight, right?
Exactly.
So you think the same thing should be for the vaccine. These are not weight-based, but there is a dose that's specialized to the 5 and 11 and then the 11, to 17. So there are dosing that's done by age, not by weight.
Okay, so the age is what's important, not the weight. Good.
And there's specific criteria that, so let's say you're, 10 turning 11, or you're 11 turning 12. There is specific criteria if you got the first dose when you were 11 versus the second dose now that you're 12.
Okay, good.
So what they'll do is if you do turn 12 in between the time frame, they'll give you the dosing that you would have gotten as an 11-year-old.
Okay, good. That's clear. I think it's, and the last question is, it seems that children during the school year or during the year, they have a lot of different vaccines. How does that affect? Aren't we over vaccinating our kids? Like my daughter, she's required to have she has her medical checkup today. And then it's like, maybe they'll give her the flu shot, but then she had the COVID vaccine last week. So aren't we over vaccinating?
So I would always check with your provider, your pediatrician or your advanced practice provider, and they will help to guide you on the timing of the different vaccines.
Cool. Thank you very much. Elizabeth, is there anything else that you would like to share to tell people that are watching us now?
So I would ask us to come together as a community to get vaccinated so that we can, it's going to be around for a couple years. I don't even know how long it's going to be around, but at least to make sure that people don't get sick and don't get hospitalized as a result of this. If there's something you could do different to save your life and save another person's life, that you have the power to do that by getting vaccinated.
Yeah, that's so well said. It's not only about protecting us, it's about protecting our community and others, right?
Yes.
And I think I wanna, because the holidays are coming, I wanna finish with this message that says, count your blessings, right?
Mm-hmm.
That's what I want to share with you and with everybody else. Count your blessings because there are many. There are many things that we are blessed about, and we can do this to help our community and the world.
Absolutely. Thank you for that. That was beautiful.
Thank you. Elizabeth Weiss, president of Lehigh Valley Hospital, Pocono, has talked about the vaccines and how we can protect our children with the vaccines. And we have talked about the different concerns that I have gathered from different parents. If you people have more questions, please send them to me and I will send them to Elizabeth. And I want to thank you very much for your time and happy holidays for you too.
Thank you. Same to you, and happy holidays to all of your viewers, as well as you and your family.
Thank you. Thank you, Elizabeth.